Welcome back to Thoracic Talks, your beacon through the maze of heart, lung, and upper gastrointestinal health. In today's journey, we're exploring lung cancer screening, its importance, eligibility, and the impact it has on health. Breathe deep as we dive into the essentials of lung cancer screening. Why is lung cancer screening crucial? What's its primary goal? Who's eligible for it, and where can you undergo this screening? These pressing questions are the focus of today's episode, aiming to enlighten and motivate you or your loved ones to consider lung cancer screening. So, what exactly is lung cancer screening? Picture a superhero's magnifying glass zeroing in on our lungs, scouting for early signs of trouble. Through a technique known as low-dose computed tomography, LDCT, doctors can detect lung cancer at its nascent stages. Early detection significantly boosts treatment success and can markedly extend life expectancy. Curious about lung cancer stages? Check out our detailed video on lung cancer staging. Who's a candidate for this crucial screening? It's primarily aimed at adults with a significant smoking history but without lung cancer symptoms, a preventive measure for those who've waged a lengthy battle with cigarette smoke. Eligibility criteria include being aged 50 to 80 and having a 20-pack year smoking history, a calculation based on your smoking habits. If this history exceeds 20-pack years, you're a candidate for LDCT lung cancer screening. Why prioritize screening? The answer is simple: early detection of lung cancer can be life-saving. Think of it as identifying storm clouds before a tempest, offering a chance to prepare and protect. Supported by the National Lung Screening Trial, NLST, results in 2011, which demonstrated a 20% reduction in mortality from lung cancer among high-risk individuals screened with low-dose CT, the importance of lung cancer screening is undeniable. The screening involves a low-dose CT scan, a quick, painless procedure capturing detailed lung images without the need for contrast dyes or injections. It's a breeze, with no needles or discomfort involved. To access this preventative health measure, certain criteria must be met: being 50 to 80 years old, a current or former smoker with a significant smoking history. These criteria ensure that those at the highest risk receive priority for screening. Like any medical procedure, lung cancer screening has its pros and cons. The main benefit is catching cancer early, greatly improving treatment outcomes. However, there's a risk of false positives, which means the findings that may appear concerning end up not life-threatening, potentially leading to unneeded anxiety and follow-up tests. The radiation dose from LDCT is minimal, significantly lower than that of a standard CT scan, reducing exposure concerns. Interested in getting screened? Consult your medical care provider. They will guide you through the decision-making process, determining if lung cancer screening is right for you and how to proceed. That concludes our guide on lung cancer screening. Remember, armed with knowledge, you have the power to make informed health decisions. Stay inquisitive, seek information, and prioritize your lung health. We hope this episode inspires you or a loved one to pursue screening, potentially saving lives. Despite Medicare coverage since 2015, only a fraction of eligible individuals undergo screening. Don't miss out on this life-saving opportunity. Contact your primary care provider to discuss lung cancer screening. Together, let's beat lung cancer through early detection and education. The information provided in these videos are intended for educational purposes only. This information is by no way meant to replace the advice of your medical care provider. My vision is that the educational material provided allows the viewer to have a more fruitful conversation with their medical care provider by having an increased baseline understanding of their disease process. Remember, knowledge is power. Always ask questions and keep learning. Found this guide helpful? Like, share with friends, and subscribe for more invaluable health insights. See you in the next Thoracic Talks episode, where we unravel the complexities of chest-related health issues for patients and their families.